Hi, this is Hailey Dean with Diagnostic Medical Sonography 4420 Vascular Imaging. I did my case study on May-Thurner syndrome, also known as iliac compression syndrome. My case study was on a 28-year-old female, patient history of hypothyroidism, obesity. Lab values all came back normal. Some basic chemistry workup, CBC, chest x-ray, PT-INRs, EKG, echo. Presenting symptoms were shortness of breath associated with a cough, ongoing for about a week. The image findings, lower extremity Doppler showed an extensive thrombosis of the left common femoral, greater SAF, posterior tibial, popliteal, and peritoneal vein. CT of the chest with contrast showed bilateral pulmonary embolisms, and CT of the abdomen showed the clot going all the way into the IVC. Differential diagnosis could be leg edema, deep vein thrombosis, chronic venous disease. MTS can present as acute or chronic, DVT leading to PEs, as in the case of this patient, with chronic leg pain, chronic ulcers, changes in skin color and pigmentation. The incidence is kind of unknown, but can range from 22 to 32%. MTS-related DVTs account for only 2 to 3 of all the lower extremity DVTs. Who's most likely to get MTS? Females, those that are postpartum, have had multiple children, or are taking birth control. Those that have blood clotting disorders, those that suffer from dehydration, or even scoliosis because of the impact it has on the spine. What is MTS? It's where the left common iliac vein is compressed against the fifth lumbar vertebrae by the right common iliac artery as it crosses in front of the vein. There's different stages to the disease. First one being kind of the structural compression and typically asymptomatic. Second one, branching out into spur formations and putting you at risk for edema and DVT, typically asymptomatic but can start to show symptoms. And the third one begins with obstruction that does cause DVT, edema, and other problems. And this stage, symptoms become prevalent. Treatment, successful treatment of MTS is directly related to the DVT and repairing it, removing it, and the use of medications such as anticoagulants to prevent clots and thrombolytics to treat clots. Prognosis depends greatly on the presence of symptoms and their severity and whether or not there is a DVT and how it's treated. The textbook also mentioned that the left leg has a higher incident of DVT than the right leg because the left common iliac vein crosses under the right common iliac artery, and it can sometimes become thrombosed in this area. MTS is treated only when it's symptomatic. Previously, open surgical procedures were most commonly done, but now there's a lot of less invasive repair options for people. The typical treatment is to remove the clot, and this can be done with medications and mechanically through suction, and also with the use of stents and balloon venoplasty. Following placement of any stents, patients are then treated with anticoagulants for at least 6 months to prevent restenosis. This particular patient underwent IR-guided venography, revealing duplicate femoral veins. They used medications and a mechanical removal of the blood clot using suction as well. Medications were then started. The patient underwent venography again, which revealed then a narrowing of the left common iliac vein after the treatment of the thrombosis. Venoplasty was then done with 2 stents in that area. The patient recovered and was discharged and told to closely follow up with her primary care physician. And the patient was also instructed to continue the anticoagulants and discontinue birth control for 6 months. These are my references. This is some normal anatomy to kind of refresh you, where I was talking about with MTS, the left common iliac artery with the left common iliac vein right next to the lumbar vertebra. And then here you can see like what I was explaining with the clot traveling all the way into the IVC. And then there's that left common iliac artery again, left common iliac vein. And then this patient also was even having issues with the greater saph there at the bottom. This is the Doppler from my patient's imaging, Doppler of the left common femoral vein. And again, Doppler, the left common femoral vein, demonstrating extensive thrombosis, loss of flow on Doppler. Vein also demonstrates an increase in size and non-compressibility, showing DVT. And this is the CT, showing the right common iliac artery crossing in front of the left common iliac vein. And then the venography showing the complete occlusion of the vein in the left leg using dye where it doesn't pass beyond the popliteal. And then also this patient with the duplication of the femoral veins. And then this is kind of a nice illustration of what MTS looks like. Thank you very much.